as our last guest told us, heart conditions can sometimes seem like that they come out of nowhere, but there are actually lots of warning signs. You could have unexplained aches and pains, swollen feet and ankles, or shortness of breath. Those are all potential indicators for heart issues. So Dr. Coley, when should someone go right to the doctor?
Yeah, so if you're having new symptoms, changing symptoms, or worsening symptoms, and I like to say the biggest flags for heart disease are symptoms at night that wake you up from sleep, or symptoms when you're exerting yourself. So do not ignore those. And as we heard from Sabra, they can be subtle. They don't have to hit you over the head. The shortness of breath that makes you stop in your tracks, but just, hey, I'm slowing down a little bit more. And for women, we can have atypical symptoms like really bad nausea, back pain, fatigue, uneasiness, kind of queasy inside. All of those can be symptoms of heart disease.
But not men. Women have to deal with that, huh?
Men can too sometimes as well, but less commonly. They'll usually get that movie-style elephant on the chest where they're clutching their chest and they've really got a tight pressure. But ours can be more subtle, and we don't think about it, ladies, because we're always thinking about somebody else, right?
Always
Our
putting
kids, our
everybody else
husbands,
first.
our families, our work.
You like that, Jeff?
Yeah, I
I'm
do.
poking you.
Well, hopefully I just drop dead when I have any symptoms.
Don't say, Jeffrey.
What?
You're a father to two. Knock on wood.
Yeah, especially on heart.
You were thinking it.
Knock on wood.
I'll say this. Are there any any kind of symptoms that their partners could look at to kind of look for?
Yeah, and sometimes other people will sort of tell you what you need to look for. But I have to talk a little bit about specific risk factors to women, because I think women have all the risk factors men have. We have a bigger whammy from the same risk factors. Like if our triglycerides are up, it actually confers higher risk. But then our life cycle, our hormonal life cycle of having our period, carrying a pregnancy, becoming menopausal, these confer different risks at different phases of our life. So menopause is one of the biggest risk factors that women are going to have. Every single woman is going to have that.
I'll just say this in closing, and I think I speak for a lot of men that have women in their families. They show up for us a lot. Like, ladies, please show up for yourself and go. If you're not feeling right, go find your Dr. Coley.
Aw, thank you, Al.
Thank you, Al.
Thank you, fam.
Sweet.
Or your Dr. Jackson.